All right, mission briefing. I need you to stop thinking of the liver as just an organ. From now on, it's a massive, complex chemical refinery. And those liver function tests, your LFTs, those are the urgent daily reports coming straight off the refinery floor.
And right now, the report is critical. Look at these numbers. ASD and ALT are through the roof. The refinery is literally screaming for help. So our first logic gate, our very first move, is to decode this signal and figure out the pattern of injury.
So here's how we break it down. There are really two main patterns of attack. If the alarms are blaring from AST and ALT, we're looking at a hepatocellular pattern. That means the liver cells themselves, the workers in the refinery, are under direct assault, usually from viruses or toxins. But if ALP and GGT are the ones spiking, that points to a cholestatic pattern. Think of that one as a plumbing problem, a physical blockage in the pipes, most often from stones.
Now let's zoom in on a huge clue, a real smoking gun. If you see the AST level is more than twice as high as the ALT, that's the Doritis ratio. And it's a massive signal pointing straight to one specific culprit, alcohol. That ratio is practically a confession that alcohol is the toxin causing the refinery to blow up. You gotta remember that ratio.
Okay, hold. Before we go any further, we have to engage our mandatory safety protocol. This content is for educational use only, designed specifically to help you master your international medical board exams. It is not, I repeat, not medical advice. For any real-world clinical decisions, you always consult official guidelines and a specialist. Protocol engaged.
All right, protocol's clear. Now that we've got the basic patterns down, let's defuse a classic trap, one you'll see on your boards for sure. It's a tricky scenario involving hepatitis B serology that we call the HBV window trap.
So, picture this. A patient comes in, they're tired, they look jaundiced. An intern on the floor runs a quick hepatitis panel. The surface antigen, HBsAg, comes back negative, and the surface antibody, anti-HBs, is also negative. So the intern thinks, phew, not hepatitis B. Is that a safe call? What do you think?
No way. It's a trap. And this timeline shows you exactly why. There's this insidious kind of sneaky window period right in the middle of an acute HBV infection. It's a time when the surface antigen, the initial sign of infection, has already disappeared, but the protective antibody hasn't shown up yet. So if you only look at those two markers, you will miss the diagnosis every single time.
So what's the takeaway? The absolutely critical point is this. You have to check the anti-HBc IgM. During that window, the IgM core antibody is the only thing that will be positive. It's your only witness to the crime. Let me say that again. Never, ever rule out acute hepatitis B without checking the core antibody.
Okay, let's hack into another master-level trap that pops up on exams all the time. This one's about toxins that basically hijack the liver's metabolic pathways, forcing them to go haywire and creating some really dangerous situations. Our job is to identify these hidden toxins.
You probably know that the antidote for an acetaminophen or paracetamol overdose is N-acetylcysteine. But your board exam isn't going to ask you that. They're going to test you on the mechanism. See, when someone overdoses, the liver's normal processing routes just get completely overwhelmed. The whole system is forced to shunt the drug down a side path, and that path creates this incredibly toxic metabolite called NAPQI. It's like a toxic storm that just eats away at the liver cells from the inside out.
And hey, while we're talking about toxins, you have to watch out for the metallic mimics. They look similar, but they're totally different. If the question gives you an elderly patient with this weird bronze diabetes, your mind should immediately jump to hemochromatosis. That's an iron overload. But if it's a young patient, maybe with tremors and those classic Kayser-Fleischer rings around their eyes, that's Wilson disease. That's a failure to get rid of copper. Two different metals, two totally distinct clinical pictures.
Okay, we have covered the critical logic gates. Now it is time to lock this stuff in. We're going to run a rapid-fire drill to burn these associations directly into your brain, into your neural matrix. You ready?
Let's go. AST greater than ALT, 2-to-1 ratio. That's alcoholic liver disease. Remember, S is for Scotch. ALT greater than AST, think viral hepatitis or MASLD. Got an isolated high ALP, but the GGT is normal? That's not the liver, that's coming from a bone source. The one and only marker for that HBV window, anti-HBc IgM. The screening test for Wilson's disease, low ceruloplasmin. And for hemochromatosis, you check the transferrin saturation. Boom.
Logic sealed.
Excellent work. You've mastered reading the initial damage reports from the refinery floor. But what happens when the damage is so bad that the entire system doesn't just sputter, it starts to fail completely? Well, that's our next mission, confronting the systemic storm we call cirrhosis. See, understanding the enzymes is step one. But when the refinery truly fails, the pipes back up system-wide. And this leads to catastrophic consequences. You get a storm of fluid building up in the abdomen. That's ascites. You get a flood of toxins that bypass the liver and go straight to the brain, causing encephalopathy. This is the next level of complexity. So, welcome to the cirrhosis matrix.
To master this matrix, you've got to answer tougher questions. Can you calculate the SOG, the serum ascites albumin gradient, to figure out why that fluid is there? More importantly, can you manage the lethal threat of spontaneous bacterial peritonitis, a life-threatening infection of that fluid? These are the high-stakes challenges of our next target.
Mission G3.1 is secured. You now have the tools to analyze the refinery reports. Your next target is G3.2, cirrhosis and portal storms. Prepare for the next module.